Hello everyone. Today we will discuss about one important clinical aspect, that is about procalcitonin. So this is one of the commonest investigation which will be considered in ICU setups. So we'll know the details about this molecule. First of all, what is procalcitonin? So we have to understand that this is nothing but a precursor form of calcitonin hormone. So it is a precursor form. In the sense, it is a protein molecule. It is a protein molecule which is considered as a biomarker for the detection of infections. So it is a protein molecule utilized as a biomarker of infections. That's why when the patient is having especially sepsis, severe infections, we often ask for procalcitonin levels. So what is the trigger for its release in the body? For this, the answer is mainly cytokines. We know that in sepsis, there will be cytokines release. So these cytokines are responsible for the release of procalcitonin. And what type of cytokines? Especially the ones which are produced during bacterial infections. This is very important point. So mainly the cytokines which are often released during bacterial infections will lead to the secretion of procalcitonin. Then what about viral infections related cytokines? They are not related to procalcitonin release. That's why whenever the infection is in doubt whether it is because of bacterial or viral infection, we can consider utilization of procalcitonin. And what is the use in clinical practice? Mainly, just remember, it is used for de-escalation of the antibiotics. So de-escalation of antibiotics. That's why this particular investigation will help us to prevent antibiotic resistance. So it will help to prevent antibiotic resistance. So the point here is, whenever we are dealing a case of sepsis, we have to consider the assessment of bacterial or viral mainly based on the clinical presentation and the most common organisms which we should be knowing. So once we start the therapy with some antibiotics in bacterial infections, when the individual is responding to that particular things, and we want to de-escalate the antibiotics so that we will not keep on giving the same thing for a longer duration, which can lead to antibiotic resistance. In such situations, we can utilize procalcitonin. Mainly it is for the de-escalation of antibiotics. This point is very important to consider. And there are some situations where it is falsely elevated. Commonly, it is elevated in the sepsis, mainly bacterial infections, but in some situations like trauma, burns, malignancies, cirrhosis, or some cardiogenic shock, even in CKD, we can expect falsely elevated levels of procalcitonin. So in such situation, it is not ideal to consider or to take any decisions based on procalcitonin levels. So what is the practical utility of this one? See, we know that there are some other systemic inflammatory markers like CRP, ESR, but they can't distinguish between bacterial and viral infections. So in such situations, we can utilize procalcitonin. So we can consider it is superior to CRP, ESR in detecting bacterial infections. But today's consideration of this particular biomarker mainly helps in start of antibiotics in case of acute exacerbation of COPDs. So here we know that majority of the times for acute exacerbation, it is due to lower respiratory tract infections, and among them about 50% of the times it will be bacterial, and other 30% of the times it will be viral. So when an individual presents to us with acute exacerbation of COPD, when it is not that sure whether it is bacterial or viral, we can consider sending procalcitonin levels. So if it is raised, consider start of antibiotics. Otherwise, antibiotics are not required. So this can prevent unnecessary use of antibiotics. This is the practical utility. But the problem here is cost of this particular investigation. In India, at present state, it is costing up to 1,500 to 3,000 rupees to get this molecules level. So it will be a cost burden for many patients. And as we have seen, it is not of much utility when it comes to any initiation of the treatment. Mainly we saw that it is for de-escalation of antibiotics. So better to judge situation clinically, and in some situations start the antibiotics if it is looking like bacterial infection and look for the response. So clinically and some other laboratory parameters like complete blood count we can rely upon instead of this costly investigation of procalcitonin. Better to utilize this only for de-escalation of antibiotics. This is the overall point about procalcitonin biomarker. Hope you got the point and you can utilize this information in your day-to-day practice. Thank you so much. See you in next video.